Hi, my name is Bia Mumm. Thank you to the Society and the Scientific Committee for the opportunity to present this research on behalf of my collaborators. These are the relevant disclosures for the study PI, Dr. Heidi Brown. I have no additional disclosures. This project was funded by the sub-award from the PLUS Consortium, whose mission is to advise science to conduct future prevention and intervention studies for lower urinary tract symptoms in girls and women. In the initial funded project, we partnered with the Population-Based Statewide Survey of the Health of Wisconsin, or SHOW, to ascertain what distinguished women who engage with bladder health promotion, depicted in the figure as end users in the yellow circle, from those in the target sample who did not, depicted in the larger circle with the light blue area. Because SHOW collects comprehensive data on approximately 1,000 residents annually, we could disseminate bladder health promotion materials to a group of women with known characteristics and then identify what distinguished those who did and did not engage with materials. In the initial study, bladder health promotion materials were mailed to all adult female participants in the 2016 SHOW sample with a cover letter introducing the materials. 2 weeks later, a written mail survey inquired about their use of these materials. We interviewed a subset of participants to understand the reasons behind use, and many said receiving electronic resources via postal mail was not helpful. Based on that feedback from participants in the initial mail survey, we added an electronic component to disseminate the same evidence-based bladder health promotion materials and to collect information by email instead of mail about whether participants engaged with them. Our objectives were to understand the reach of bladder health promotion specifically via email and to compare our findings from the previous postal mail study with the current email study. For this study, an email with a link to a bladder health promotion website was sent to the adult women participants in the SHOW 2017 sample, since we had already used the 2016 sample in the mail survey. This screenshot depicts the study website with tabs for participants to watch the Tulip video, download the TAT app, and view or download a written brochure. An email survey was sent 2 weeks later asking the women about accessing the materials. Descriptive analysis characterized engagement and compared responders and non-responders from this sample and the prior mail sample. This table describes the sample of respondents and non-respondents in the 2016 mail survey on the left and the 2017 email survey on the right, with a third category for the email sample of those without a valid email address. You can see that 214 of 399 women in the 2016 SHOW responded to the mail survey for a response rate of 54%, while only 122 of 437, or 28% of women in the 2017 SHOW responded to the email survey. Of note, 29% of the 2017 sample did not have a valid email address, so the valid response rate was 39%, which is still significantly lower than the mail response rate. There were statistically significant differences in the ages of women who did and did not respond to the mail and email surveys. Women who responded to the mail survey were significantly older than those who did not respond, and were older to both responders and non-responders of the email survey. Women without a valid email address were the oldest with a mean age of 62 years. Women who did not respond to the mail survey were the youngest with a mean age of 45 years. Women who identified as non-Hispanic white were more likely than any other racial or ethnic groups to respond to the mail survey, and were less likely than any other groups to lack a valid email address. College-educated women were more likely to respond to the mail survey, and women with a high school or lower education were more likely to be without an email address. Women with an income level above 200% of the federal poverty level were significantly more likely to respond to the mail survey, and almost half of the women below that income level did not have an email address. And finally, women living in rural areas were more likely to respond to the mail survey, and there were no differences were seen in response to the email survey by geographic area. In this figure, the red bars represent mail survey respondents who access bladder health promotion materials, and light blue represent email survey respondents who access materials. Among respondents to the mail survey who access materials, Over 70% looked at the brochure, while only 31% viewed the video and 18% visited the website. Among email survey respondents who accessed materials, more than half visited the website and over 40% viewed the Tulip video, with 10% downloading the TAT app. In conclusion, mail dissemination resulted in higher overall engagement with bladder health promotion than email dissemination did. Email dissemination reached younger, more educated women with a higher income level, while mail dissemination reached rural women. Both email and mail disproportionately miss women whose racial or ethnic identity is not non-Hispanic white, and those with fewer resources, including lower education and income levels. Future work must partner with these women through community engagement to tailor outreach to minimize disparities. Thank you for your attention, and I welcome your questions.